So, probably most of the multiple sclerosis patients present also with CCSVI. But there is also a group, not very big anyway, it's about 5%, let's say, of multiple sclerosis patients in whom we cannot find a venous problem, at least using currently applied diagnostic tests. Maybe these patients are completely free from venous pathology, or maybe they present with something that we cannot find at the moment. We'll see in the future. But here's another problem. What about other people without MS? Are they present with CCSVI or not? At the moment we know that at least part of the so-called healthy population present with CCSVI. In study in the United States, in Buffalo, they found this problem in about 20%. I know also about some non-MS neurologic patients that are also present with venous pathology, and because we performed a lot of Doppler sonographic examination, other vascular problems, we found sometimes such a venous pathology in patients scan for coronary carotid artery stenosis, for Raynaud phenomenon, for different things. So most likely CCSVI is more common than multiple sclerosis. But of course this requires more studies, perhaps using invasive procedures and so on. This is another analysis which we performed in our hospital. We tried to find a correlation between the clinical characteristic of multiple sclerosis and CCSVI. Of course, it's an indirect analysis, and these data are most likely biased. Anyway, we can draw some conclusions from this analysis. So, in short, most likely these venous vascular abnormalities are rather stable. They progress very slowly, but they are congenital. They do not develop later, but most likely they are present after birth. The question is, what about this time from the childhood to the age of 20, 30, 40 years when MS starts? Which is very important. Multiple sclerosis does not seem to have a significant impact on the degree and progression of this venous pathology. So it is not the case that the multiple sclerosis via some substances may evoke this venous pathology. But also from our analysis, it seems that the direct trigger of the start of MS, the first attack, is not CCSVI. There must be something in addition. Maybe there is another factor or factors which most likely acts together with CCSVI, and these two or couple of things make a problem. Also, we found that not only multiple sclerosis symptoms correlate with CCSVI. Of course, we found a correlation between most of the symptoms, but for example, heat intolerance, which is a very typical sign of MS, of course not in all patients, but in a majority of them, was not correlated with degree, duration, and so on of CCSVI. Also, chronic fatigue, which is a hallmark of the disease, was only slightly correlated with degree of CCSVI. So we can conjecture that perhaps these global neurologic symptoms are maybe related to this other not yet known factor. These are also very interesting findings. In our hospital, we examine all this patient with optical coherence tomography. It's a special examination of eye. Here you can see normal findings, and here is patient with CCSVI and multiple sclerosis. This patient presents with severe injury to the optic nerves and the retina neuronal cells. And this phenomenon, of course, is known that the patient with multiple sclerosis suffer with some with ocular findings, but here for the first time we have found that this ocular problem correlates with CCSVI, and which is very interesting, you might think that the more severe CCSVI was the more severe damage to the optic nerves was present. Now we found that a patient with a problem with their eyes presenting mostly with only one internal jugular vein occluded. Interesting, patient with occlusion of azygos vein did not experience eyes problem, of course, on condition that there was no problem with jugular vein. Which is also very interesting, this OCT findings are to some degree similar to those which are seen in the glaucoma patients. Glaucoma is a disease of the eye which results in blindness, and now glaucoma is regarded as a vascular problem, not ophthalmological one. So, which mechanism could be responsible for trigger multiple sclerosis problem in CCSVI patient? Of course, we don't know it. There are several hypotheses regarding it. For example, Professor Zaboni opts for a role for iron in this pathology. It is also hypothesized that perhaps this pathologic venous outflow may result in breakdown of the blood-brain barrier, and in this way autoimmunity starts. Now we concentrate on another hypothesis. Of course, it's only hypothesis, and we'll check it. We think that maybe an interplay between astrocytes and neuronal cells may play a role in this pathology. It's known, for example, that astrocytes are equipped in special mechanoreceptors on the pseudopodia, and maybe this abnormal flow results is in this abnormal astrocytic function, but we will see in the future. Another problem, is the endovascular treatment for CCSVI safe? This is an abstract from our already published study. You can see there's a big group of the patients, over 500 of endovascular procedures performed, and in our patient there were no serious complications related to the procedure. No death, no cerebral stroke, no stent migration, and so on. Only some problem with stents. There were thrombotic occlusions of already occluded internal jugular veins. So, of course, the procedure was not very successful, but most likely there was no additional harm for the patients, and some minor technical problems, not very serious, like local bleedings, atrial fibrillations. Some technical problems are there for doctor, not for the patient. So we can conclude that from this group, but of course now we have a much larger group of the patient which perform the procedure, that the procedure can be regarded as rather safe. But if it is